Hello, everyone. My name is John. I wanted to do a quick little video vlog about hip replacement surgery. I was diagnosed a few months back. I've been having issues with my left hip and my groin for I don't know, 15, 20 years, and then over the past 5 years, it's kind of gotten worse. I was in a bicycle accident December of 2020, just a couple months ago, and I went to the emergency room, and they took a lot of X-rays, and didn't break any bones. Ended up hurting my right side, some of my ribs, shoulder. Had a lot of abrasions, and I was hurt pretty bad. But when they came out and said that I didn't have any broken bones, but the doctor said to me, "Are you having any pain in your left groin area or your left hip side?" And I said, "Yeah, I actually had an appointment with my regular doctor the following week, just to have it looked at." And my doctor said, "Well, you're going to have a hip replacement. You have severe osteoarthritis in your left hip." And it made me feel relieved that I knew, what maybe that pain was coming from. So I went on and went to the doctor the following week, my regular healthcare professional, and then he looked at some X-rays, and he called the orthopedic, and then he said, "You need to set up an appointment with him. I'm going to show him some of the X-rays." So the same day, on my way home from my regular practitioner, I got a phone call right away from the orthopedic office, and said, "Listen, we're so-and-so from Kaiser Orthopedics, and you need to come by as soon as you can." So they sent me an appointment for the next day. So I met with a Dr. Donahoe from Panorama City over here outside of Los Angeles the next day, and I went in for like 4 more X-rays. Took the X-rays. Went and sat in one of the offices and waited on the doctor to come in. And when he came in, he had this model in his hand, and it was a model of a hip replacement. And I knew right away that's what was going to happen. I didn't. I didn't think it'd be that severe, but then when I saw him with that prosthetic in his hand, was anyway. So he set me down, and he explained what was going on. Said that my left leg was about 4 millimeters shorter than my right, because I had this birth defect. It was called a cam defect, cam defect, and it's where the top of your femur, the ball joint that goes into the joint, is round, but then it should be shaped like a light bulb at the bottom. Mine had a hump in the front of it, like at the very bottom, was not round. It didn't go in. It had like a kind of a hump shape to it. So I trained on a bicycle. I've been racing bikes on and off since I was 13, and I'm 48 now. So the repetitive motion of me riding that bicycle and walking upstairs, and just everyday motion, ended up wearing out all the cartilage that was in that joint. And I'd been having this hip pain for years. I first felt it when I was in my 20s. It was kind of a groin pain. I just thought I strained it from riding the bike or playing ball or whatever. And anyway, long story short, the repetitive motion of me riding a bicycle ended up destroying all the cartilage that's up inside my joint. And then I have some fractures that's in the top of the ball joint that's have filled with fluid, and I have bone spurs and things from it, just normal osteoarthritis kind of stuff. So anyway, I go in tomorrow, which is Monday, March the 29th, 2021. And I have a buddy of mine who's going to come and pick me up early in the morning. I'm the first operation up. So I'm going to have someone kind of film kind of the recovery process. I kept riding my bike up until last week, where I just got to where I couldn't pedal anymore. I've been walking with a cane for the past week or so because I can't put any pressure on that area. So I'm just hoping this video helps. I'm going to post it up there. Anterior approach, hip replacement surgery, total hip replacement. The doctor says that what they're going to do is they'll go in and they'll give me an epidural, and they'll put me to sleep and do these markings of in the area of the area he's going to cut. It's about 6 inches, 5 to 6 inches long. It starts lower than my abdomen on the left side, near the front of the hip. And he said, they'll give me an epidural. They'll take me to the back. He says what he's going to be doing is once he opens me up, and they put me on this table. In this table, I'm kind of strapped into like how did he put it? Ski boots, if you will, ski boots. And what'll happen is it keeps your legs separated. And then when they start doing the operation on it, they'll open it up, and then they have these tools that will go down inside, and it starts separating the muscles, the tendons, nerves and stuff. It doesn't cut anything else. It doesn't cut any muscle or any other tissue or whatever. It gets inside there where it gets to the joint, and they take a tool and then they drop the leg down, and he dislocates the femur from the socket. Kind of freaks me out. And then he says what he'll do is when he takes that out, he reviews stuff while he's in there, and then he's going to take a saw, and it will saw off the top of the femur, the actual ball joint, the ball, not the joint, but the ball that's there, and it will saw it completely off and remove it. He says once he takes that out, he'll go straight to work on they call it the acetibulum, which is the hip socket, where he'll clean out the area that has all the old cartilage and tissue or whatever in there, and they use this drill that has a cup on it. It's kind of like shaped like a bowl, but it's really rough, porous, I guess. And they'll go in and they'll drill and they'll smooth it out, and he'll make it to a certain size, and he'll keep sizing up till he uses till he gets to the actual size, and then he will take it's called the acetibulum joint or whatever, and it's made out of titanium, and it has like a porous surface over it. So they'll take that in, and then he says he'll kind of beat it in there with a hammer. If it has a good fit, I won't need any screws or anything. They don't do any cement or anything like that. Either what will happen is your bones will actually grow to the porous material on the back of the titanium. And if the fit's not super great, he said he'll go in and put a couple screws. Once he gets the acetibulum in the joint and it's cleaned out, he'll go back to the actual femur where he had sawed the ball joint off. And he uses this thing called a broach, it looks kind of like a really sharp knife with a flat end on it, and it's kind of like a curve. And he'll take and he'll mark the area where he is going to actually take this broach and beat it into the inside of my femur. And he starts with a certain size. He beats it in there, and they'll take it back out, beat it in there, take it out, and then he'll go to a larger size. He'll take it and beat it. So he's actually just kind of like making room for the actual size prosthetic that he wants to put in there, or brooch is what they call it. So once he gets to that exact size that he wants, he'll end up using the actual piece that's going to go into my body, knock it in, and it will stay there. Then he'll start using, I don't know if he's going to use porcelain or metal. I know the inside of that titanium, they'll put a metal, a plastic sleeve inside there, or some type of polymer. And then they'll either put a metal ball, which is going to take place of the part they sawed off, either metal, or they use porcelain or whatever. I don't know what size they use. They have different sizes for different. So what they'll do is he'll do some practice parts where he'll put them on there. Then they'll put my socket back in, take a couple X-rays until they find the right size ball and length of brooch that they want to use until they get to the perfect sizing. Then they'll drop and dislocate it again, and then they'll actually put the actual parts that's going to be in my body for the next 20 or 30 years. Once they put those back in, they start putting it back together, let the tissue kind of move. Then move me back up, straighten the legs up, and they start taking X-rays to make sure the legs are close to the same length as possible. Sew me up and wheel me off into the recovery room. He said that the surgery will take about 2 hours. I'm first up in the morning at 7, so could be home around 2:30, 3 or 4 o'clock in the afternoon. So my friend will come pick me up. So anyway, I'll get some videos tomorrow from coming out of the hospital and kind of going through exercises that you have to do and see what the recovery is going to be like. Again, I'm a 48-year-old male with severe osteoarthritis from cycling, and so anyway, this is supposed to be better and supposed to be helpful, and hopefully I'll be free of pain pretty soon. So stay tuned, and I'll make some more videos as I go through my recovery. All right, thanks.